Hello and welcome to the Kurist podcast. I am joined today with Dr. Mohamed Morad. He is the CEO and co-founder of Kurist, as well as a physician on the Kurist platform. So welcome with us today.
Thank you for having me.
Yes, of course. Well, I would love to start us off with just hearing a little bit about you and a little bit about what you do.
Okay, I'm a practicing physician, internal medicine, mainly at the hospital. So we call it hospital medicine. I've been doing this for the last 10 years. I've done training in the Middle East and I've done training in the United States. I've also done MBA in business at Kelley School of Business at IU. And I founded Kurist with my co-founders who are amazing physicians as well.
I love that. Well, thank you for sharing.
Yeah.
All right. Well, I would love it to kick us off with the first question. I think you have a really interesting story and a really cool background of how Kurist was born. So as a physician with such a passion for helping other people, and then also being the CEO of a company to kind of make that happen, what would you say is the biggest vision you have as a tool of change? Or how do you see combining those two passions of yours as a tool for that change?
Yeah, so that's a very good question. So when I was like in the medical school, I had a lot of interest in the IT world.
Absolutely.
And I've done some work on the side as also being a practicing physician. So I always had passion for IT work. And then I'm a practicing physician. I've achieved the American Board of Internal Medicine, and also I've done business school. So if you look at Kurist from all dimensions, that it's basically it helped me put everything together and have something born out of it. And I have a huge passion for basically bridging the gap in knowledge at any level. Either patient wanting to know more about their illness, a physician who would like to know more about how to manage a patient, also like even a business that's actually working and trying to achieve something. And that gap in knowledge, I'm always passionate about bridging. In medicine in particular, bridging a gap in knowledge means saving life.
Correct.
And that's what I'm passionate about.
Okay. No, I think that's a very great response. And I actually want to touch on, you kind of mentioned all the different facets that you've, been a part of and all the characteristics and learning and development that you've done. You mentioned you were in the IT world, and then you also are a U.S. board certified physician. And then you also went back to school in business. So kind of explain to me, walk me through that order. Why did you decide to go those different paths at that time in your life?
Yeah, I always had a passion for creating something that did not exist before.
Okay.
So, at my last few years in medical school, there was just the upcoming of the internet and websites and all that stuff. So I had a huge passion for that. And I kind of tried to explore it. And actually, I did some work from that nature to actually my medical school at that time. And then as things evolve, of course, medicine is a very demanding, not only like a job, but also in training. You cannot be, distracted with other things.
Definitely.
So I shifted, when I came here for the U.S., I trained in internal medicine. And since then, my connection to the IT world have, diminished significantly.
Sure.
But then Kurist came. I'm not going to say like I'm the one who did everything on Kurist, but at least I worked with the teams
Definitely.
To get where we're at now.
Yep.
And you can see this trend actually in physicians, in which we know that there's a lot of now IT platforms and I would say AI that actually physicians are helping and contributing to create.
Yeah, definitely.
Yep.
No, and I think it's super interesting how you just touched on, when you're in the medical school world, you're so occupied with that you don't have time for other passions. And it sounds like a huge passion of yours was IT and the world of creating.
Yeah.
So I would want to ask you, why did you feel drawn to creating and, co-creating and starting Kurist? What did you see was missing in the medical world for you to have that need to create it?
the world always look up to the United States when it comes to medical knowledge and medical insights.
Absolutely.
Um, we have some of the top physicians in the world
Absolutely.
and other regions in the world as well.
Hmm.
They have, amazing physicians who have done great things for humanity.
Hmm.
Now, because you have a difficulty to access that medical insight in the US,
Hmm.
me and the co-founders thought, you know what, we have been providing some international consultations anyway.
Hmm.
Family, a friend of a friend, or who's overseas.
Hmm.
And so we thought, you know what, why not actually make this happen on a bigger scale?
Hmm.
Why make this happens for everybody? Not because you have to know somebody in the United States in medicine
Hmm.
to have access to this kind of medical insight. We actually believe also that the physicians need to work together across, borders. Meaning
Hmm.
that I'm a physician here in the U.S. I'm passionate about knowing, and helping international patients and see also what trends they have, like what differences they have in what we do here.
Absolutely.
So it goes both ways.
Hmm.
We basically want to bridge that gap. Think of Kurist as a virtual bridge that connects both sides for the benefit of both, actually.
Absolutely.
And I believe it can build trust
Hmm.
for whoever seek that second opinion on Kurist.
Yeah.
Regardless, they change their plan or don't change their plan. But that trust piece that they have reached the top medical expertise there is
Hmm.
before proceeding with their treatment plan or diagnosis.
Yeah, you kind of touched on it, but just even having that option for a US board certified physician to talk to you, and whether you move forward with their second opinion expertise or not, just having that option, I think, is huge for any individual across the world.
Yeah.
Um,
Typically, when you get a second opinion,
yeah,
it is a second opinion.
correct.
You have to go back to your treating physician and discuss that second opinion with your treating physician.
Absolutely.
And for us, that's how we empower the patients
Hmm.
and give them more information that help them reach the best option for themselves with their own physician.
Exactly.
We don't see it. And actually, there is a huge demand on second opinion
Hmm.
inside the United States. So
Exactly.
we
Yeah.
have the top expertise in the world, but our patients still seek second medical opinion, because it's not only helpful for the patient, it's actually helpful for the medical, industry itself.
Exactly.
Um,
Yeah.
uh, because with a second set of eyes looking
Hmm.
at what's happening, you tend to make actually less errors.
Exactly. Yeah. Whether it's a lack of knowledge or just honestly someone missed something and it could have been detrimental, like it's not to blame, but I think just like you said, having that second set of eyes is really important.
Mm.
Question for you. I know probably a lot of our listeners are wanting to know this. I know we always say Curious is great worldwide, globally. Um, is Curist also an option for individuals who live in the United States but just want that second opinion
Not at this point,
expertise?
no.
Okay. Okay.
It's mainly designed and tailored for international
Perfect.
patients.
Okay. Yeah, that's great to know.
Yeah.
And then also just shifting gears, you kind of mentioned earlier how it's a great learning opportunity for both the patient and for the physician. So I have a question for you.
Mm.
How is it possible for physicians to collaborate with one another? A United States board certified physician collaborating with a different physician overseas instead of
Yes.
physician to patient, physician to physician.
Yes. So sometimes actually the patient is asking their physician to help them
Right.
get that second opinion.
Correct.
So that will be the first scenario in which the both physicians are actually collaborating
Hmm.
for that second opinion. The other options we give for the medical experts on the
Hmm.
platform is the option to mentor physicians overseas.
Hmm.
So if you're a physician overseas and you would like to have a mentor in the United States, you can easily schedule and use the services on the platform
Hmm.
to connect with the physician here in the US, who actually said they will do that.
Okay.
Meaning they decided that they want to offer this for
Mhm.
international physicians as well.
Wow.
Yeah. So I think it can help collaboration on multiple levels, not only for the second opinion.
Yeah, no, and I think that's great too, because you know how, I mean, sometimes hospitals or different programs or even conventions across the world will invite specific doctors here in the US to go and speak at different programs. I think having that virtual consultation like style definitely breaks down a lot of the borders, cost of travel.
Yes,
So I think
absolutely,
that's
absolutely,
really great.
and also it can initiate the conversation. It
Hmm.
can initiate the collaboration, but still, the expert has to go to give that
Right.
yeah,
You
to give
can,
that
that's
lecture.
inevitable.
Yes, but at least the initiation is much easier to start through Kurist.
Exactly.
Yeah,
That conversation just
yeah,
it's right there.
yeah.
No, that's great. And I think you've done a really great job explaining kind of why you have that passion, your journey about how Curist was born, and even just focusing on how you, as a physician who really cares about people, just saw a need and wanted to make something happen. And
Mm.
honestly, Curist is so unique. You don't see anything like it right now, that comes close to, the detail and the safety of the platform. So thank you for sharing that. It was
Oh,
really
thank
a
you.
great pleasure to have you on today. Thank you, doctor.
Thank you for having me.
Yes, thanks.